Hey everybody, this is Darren with General Devices, and I want to talk a little bit about some of the common communication challenges that can exist between the EMS, your ER, and potentially those internal time-sensitive teams for trauma, STEMI, or stroke. One of the common challenges that we have is using the radio or phone, which is our existing most common ways of communicating a report to the ER, to get a hold of somebody, to clearly communicate what it is that we're bringing in, and make sure that that information is recorded appropriately. And then how do we disseminate that out to an entire team of people? They're going to want to know exactly what's coming, how far away they are, what was the mechanism, whatever it is about the details of this patient, what are their injuries, and who was calling. And if you've ever been involved inside the emergency room with communication, it really is challenging. There's a lot going on there. And then once EMS hangs up that phone call or hangs up off that radio, if you need to get them back on the radio, good luck. I mean, it's a huge challenge. And so there's another option out there that can put everybody on a common communication platform and really eliminate those pitfalls that exist with communicating over the phone or the radio that require a person to physically answer that call, to ensure that they're actually transcribing and translating what's being communicated to them accurately. And then how do you share that out super easily? So eBridge is designed to bridge those gaps between the ER and EMS, and then beyond that, between the ER and those specialty teams, and bringing them all together in a common, collaborative, configurable workflow process that digitizes your time-sensitive process inside the hospital to share information seamlessly and make it so that we can connect the patient with the specialist and with EMS way faster, that are ultimately going to impact our processes and our patient's outcome by saving time for that patient. So let's just real quick show you how this looks. And so on the device on your screen, I'm going to press this button here. We'll pretend this is EMS in the field, and they're going to just start a trauma case. And so using the camera, we can save a significant amount of time. I don't have to read all those vital signs and have to repeat them for a nurse that's trying to copy them down frantically. I don't have to share the demographics because I can just take a picture of the patient's driver's license. If it were a cardiac patient and I had that print off, that EKG print off, I can simply just take a picture of that EKG print off. I can take a picture of vital signs. I can take a picture of injuries, mechanisms of injuries, what the car looks like, and share all that information to provide a really good, clear report to the entire team about exactly what this patient has been through, what their injuries are, and what's happening, as well as sharing that live ETA. And so as I'm ready to go, as you can see, this one actually requires me to put in a blood pressure. You don't have to have these requirements. This customer that wanted this one built did want those in there. So that is something that we can change and put you really in the driver's seat to do. And so let me just real quickly finish that out and hit notify. Okay, so I'm done at that point. Just over a minute into this, I've shared a ton of information with the emergency department. They're able to view that information, see who it is, a live ETA on a map there. They can see exactly how far away I am. They can acknowledge me, which is going to send an alert back, which starts to timestamp those events. And then they can actually page out their entire trauma team through this process by just clicking on that button below. So if I were the trauma surgeon someplace inside the hospital and the device here on my left was now brought into that, we'd be able to see everything that's happened in the case thus far. And so all those attachments of pictures that I put in here, they're able to look at them and see very quickly, what is going on with that patient, what were the vital signs. Even if it were something as simple as, if I wanted to add in, real quick, I'm going to add in a photo of the actual wreck into this case. Let me get back out. And so I just added that photo right there. Boom. Now everybody can see that case and everybody can see the image of what happened with that patient, all through this same HIPAA secure platform that allows us to manage our patient effectively and keep the case on track. Thank you for tuning in. Check out General Devices eBridge workflow today.